Why is that? I mean, isn't it supposed to be a manufacturer's thing?
I don't know. Most of the cars we are having here, maybe except the comfortable cars, you know, most of them are not. You sit down, you are flexing your back forward. We shouldn't be. This shouldn't be.
So, in effect, what you're saying is that the back should remain straight.
The back should be in a little bit of extension.
Okay.
A little bit of, not overextended.
When you say extension,
you
what
relax.
do you mean?
You see the way I'm sitting like this.
Okay.
This is how a normal person
How about how I'm sitting?
No, if you sit flex forward, it's not the ideal.
Flex
thing.
forward is not good.
It's not
okay,
ideal.
doctor, we're having a call. Hello.
Hello, good afternoon.
Good afternoon, Tunde. Please, let's have your question.
Oh, please, I want to ask if it's advisable for one to sit on someone's back anytime he's having back pain.
Is that what?
Okay, Tunde, I think I got that. He's asking, is it advisable for one to sleep on the back if one has a back pain?
Why not? You can't sleep on your back. You can sleep on your back on a flat surface.
Now, this surface, how should it be? Some people have said that it's good to have a hard mattress.
Hard mattress, orthopedic mattress. Let's put it that way.
Okay.
Hard mattress, not too hard of a mattress, because you will not even enjoy your sleep if it's too hard. But neither hard nor too soft, so that there will be depressions. You get what I'm saying?
So if a person's back pain is non-specific, he doesn't have an infection, he doesn't have a disease, what kind of things do you do for the person?
No, we give supportive therapy.
Can the person just take OTC painkillers like paracetamol and be okay?
You know, I would not say that, otherwise you won't get people coming to see.
Okay, hang on. Let's take a call.
There's a combination of things that you do, not only medications. He has to see.
We'll come back to those things that
right.
we'll do, doctor. There's somebody on the line now. Hello.
Hello, good afternoon, ma'am.
Good afternoon. Let's have your question.
Yes, ma'am. I want to ask the doctor a question. What are the symptoms of typhoid fever?
Typhoid fever? Okay. Is back pain one of them?
No, the problem we are having today is that typhoid fever and malaria is being overhyped, at least in private hospitals.
Overhyped.
You get back pain in all these conditions.
Okay.
And then you get fever. Maybe not, if it's in typhoid, you get evening fever. But you know, there are so many conditions that are similar in terms of symptoms and presentations. We have seen patients who have been treated for a very long time in private hospitals. I'm not indicting them, because every patient needs to be investigated fully. That's the message.
Okay.
We can't assume malaria.
Don't just treat, you must investigate.
Malaria is an endemic problem here. And then typhoid could be a problem because of the sanitary situation in Lagos.
Okay, I think we've given typhoid and malaria enough time. I just wanted, you know, an answer as regards to back pain.
No, back pain is common in them.
Okay.
But you need investigation, because even if you have TB.
It appears even for back pain, you have to conduct a thorough investigation.
It's a thorough, it's an aggressive investigation, especially if you have a back pain that is consistent and is still there for over 6 months. It has to be an aggressive investigation. You know, there are certain problems we call red flag features.
Yes.
You know, if you go to swim at the bar beach and you see a red flag, you know it's dangerous. So those red flag features are the most dangerous aspect that can cause back pain.
We must talk about red flag features when we come back. And then they
have to be investigated and diagnosed early enough.
Okay.
Before they send secondaries to other parts of the body.
Let's quickly take this call. So many calls are coming in. Hello.
Yeah, good afternoon.
Good afternoon. Your question, please.
Yes, I'm calling from Enugu.
Go on, Kenneth.
This back, I usually have some back pain sometimes after sleeping. When I woke up, my back will be paining me.
What happens after a while? Does it go?
Yes, after a while. And the thing that makes me most of the time, I don't sleep on the bed, rather I will sleep on the rug.
And does that make it better?
Hello?
Hello? Does sleeping on the rug make it better?
Yes, it makes me better, yeah.
Okay, thank you, Kenneth. Before we go back to the red flag features, what could this be about Kenneth? He has the pain in the morning.
All of us have a tendency of not sleeping well.
Okay.
We don't sleep appropriately, right? It's either you sleep on your back or you sleep on your sides. You know, you see others sleeping face down and they are twisted.
Okay.
You know, when sleeping, that's a bad way of sleeping.
But sleeping face down is not necessarily wrong, is it?
It's not wrong.
As long as you're not twisted.
Yes, it's not wrong. Because, you know, nature has a way of telling you if you sleep too long on a side, you change your position without even you opening your eyes.
Does that happen to everybody? Some people don't move at all when sleeping.
I don't think so. Everybody does.
Unconsciously,
Everybody
right?
does unconsciously.
Okay, so tell us, he says sleeping on the rug has made it better. Is there an explanation for that?
Well, maybe because of the hard surface. You know, it's smooth on the rug because this bottom is hard. You get what I'm saying? And then he gets a little bit of cushion sleeping on the rug.
Okay.
You get what I'm saying?
Now, you were talking about red flag features.
Yes, red flags are dangerous features that we look out for when the patient is telling us about his history and when we examine and find them. I've basically mentioned some of them. Infections. You know, infections from some other organs.
Okay.
They can spread to the back because there's these vascular blood connections between all parts of the body. Like TB. Okay. Like problems of the prostate glands in males, right? If it's not diagnosed early enough, the easiest way they send their seedlings to is the back. That's why we advise all males to do at least once annual prostate investigations at the labs. And then in females too, infections of the genital urinary organs cause back pain as well. When they get to the uterus, you know, uterus is directly on the back. They can cause those pains. So you have to rule out even underlying problems like frail bones, osteoporosis, you know, like other problems, kidney stones. You must rule them out.
Doctor, very quickly, because we're running out of time. What is this pain that starts at the back and hits the chest? It's like it goes from the back to the chest.
Or from the chest to the back. Peptic ulcer pain.
Oh. Wow.
You know, a lot of them are put on medications, right? Those medications have the side effects of trying to erode the internal stomach.
All right.
So one has to rule out, I won't call it peptic ulcer, I'll call it gastritis because it's an erosion. Until you do a test and then you see this ulcer there, that is when it becomes peptic ulcer.
All right. Let's have your last word because we're about to close.
Back pain is universal. It affects both the adolescents, the infants, and then the adults equally. But the infants' back pain are underreported because they may not even complain about it. It's the commonest cause of work-related disability in the whole world. And in countries where they do social securities, it's a problem because people are always asking for compensations.
Okay, so it's at that point that we have to close. Thank you so much for coming, Dr. Gbadegesin. It's been wonderful having you. And thank you so much for being with us out there for all your calls, Boyega, Tunde, Kenneth. And thanks for letting us into your home. I am Mary Alale Yusuf.